Welcome back to Heart of Hospice, Compassion, Ethics, and Burnout. I'm Miles, and today we're diving into some really important and sometimes heavy topics. You know, the kind that make you appreciate a good cup of coffee, or maybe a whole pot. And joining me today, I'm thrilled to have Katie, a seasoned hospice professional who's seen it all and is here to share her invaluable insights. Katie, thanks for being here.
Thanks for having me, Miles. And yes, definitely a whole pot of coffee for these conversations. It's a world where every day brings something new, and often something deeply profound.
Absolutely. We're going to be exploring everything from the ethical dilemmas that pop up in hospice care to the very real challenge of compassion fatigue and how professionals like yourself navigate it all while still providing incredible care. It's a lot to unpack, isn't it?
It really is. It's about finding that balance, between giving your all to patients and their families and also remembering to take care of yourself. It's a constant learning curve.
Katie, you mentioned it's a constant learning curve, and I imagine that curve gets pretty steep when you hit those ethical dilemmas, right? Like, it's not just about medicine anymore, it's about philosophy?
Oh, Miles, you have no idea. Sometimes it feels less like medicine and more like I'm a part-time philosopher, part-time detective, and full-time tightrope walker. The situations can be incredibly nuanced.
So basically, a typical Tuesday for a hospice professional. Got it.
Exactly. But seriously, the source material talks about balancing advanced palliative interventions with traditional comfort-focused care. How do you even begin to navigate that? Is there a right answer?
That's the million-dollar question, isn't it? There's rarely a single right answer. I remember one time we had a patient who, despite being in hospice, had a very specific, non-life-threatening issue that could be easily fixed with a minor procedure. But the family was torn. Do we intervene, even if it's not directly related to their terminal diagnosis, just to improve their comfort in a different way? Or do we stick strictly to comfort care as traditionally defined?
Sounds like a choose-your-own-adventure book, but with much higher stakes.
Wow, that's a tough one. What did you end up doing?
Well, after a lot of discussion with the family, the patient, and the interdisciplinary team, we decided to proceed. It wasn't about extending life, but truly enhancing the quality of the remaining time. It really highlighted how much the definition of comfort can expand.
That's fascinating. So it's not always about saying no to interventions, but about redefining the why behind them.
Precisely. It's about person-centered care, always. What does comfort mean to this person, this family, right now?
And I thought deciding what to order for dinner was complicated.
You know, Katie, you make it sound so elegant, but I bet there are moments where you just want to pull your hair out, aren't there?
Oh, absolutely. There are days I go home and just stare blankly at the wall for a good 10 minutes. It's emotionally and intellectually draining. But then you see the impact, and you remember why you do it.
I can only imagine. And then on top of all that, the source also mentions business-related moral and ethical dilemmas. Hospice care is a business, which feels a bit counterintuitive given the nature of the work.
It's a constant tension, Miles. You're trying to provide the absolute best, most compassionate care, but you're also operating within a system that has financial realities. There's competition, there are regulations, there are billing complexities.
So you're basically a saint who also has to understand spreadsheets. Impressive.
Sometimes it feels that way. You have to ensure compliance, you have to manage resources, all while keeping the patient's best interest at the absolute forefront. It's a delicate dance.
So, what's a common business-related ethical tightrope you walk?
Well, for example, determining eligibility. Medicare has very specific criteria for hospice. Sometimes you have a patient who clearly needs hospice level care, but they might not perfectly fit the 6-month prognosis box, or their documentation isn't quite there. You want to help them, but you also have to adhere to the rules to ensure the organization can continue to operate and serve others.
That's a tough spot. You're essentially caught between the letter of the law and the spirit of care.
Exactly. And that's where a strong understanding of ethical principles, both clinical and business, becomes paramount. It's not just about knowing the rules, but understanding the why behind them and how to apply them humanely.
So, the moral of the story is, if you're going into hospice, bring your heart, your brain, and maybe a good lawyer.
Malik, but you're not wrong about the complexity. Katie, thank you for shedding light on these incredibly challenging yet vital aspects of hospice care.
My pleasure, Miles. It's important for people to understand the full picture, the real depth of what goes into it.
It truly is, and it really underscores that working knowledge of ethical principles, both clinical and business, is absolutely paramount for HMDs and HPs. It's not just a job, it's a calling that demands constant ethical navigation. Katie, we've talked a lot about the intellectual and ethical tightropes you walk, but honestly, that sounds incredibly draining. How do you keep from just, running on fumes?
Oh, Miles, that's the million-dollar question, isn't it? It's a constant battle, truly. The emotional weight of the work, it builds up.
So basically, you're saying it's not just the patients who need a good nap after a long day. Got it.
Exactly, Malik. And that brings us right to something the source material highlights. The demanding roles of hospice medical directors and physicians can lead to burnout and compassion fatigue. Katie, can you break down what that actually feels like?
It's like your emotional gas tank just hits empty, but you still have miles to go. For me, compassion fatigue is when you just can't feel that deep empathy anymore, even when you want to. Burnout is more about the exhaustion, the cynicism, the feeling of being ineffective.
So one's like a broken heart, the other's like a broken spirit. Fun times.
And it's not just individual, right? The source mentions it affects the entire interdisciplinary team. How does that manifest?
Oh, absolutely. If one person is struggling, it ripples through everyone. Communication can break down, patience wears thin, and the team's overall morale can really suffer. It's like trying to row a boat when half the crew is exhausted.
That makes perfect sense. So, how do you even begin to recognize the early signs in yourself or your colleagues? Is there a secret handshake for "I'm about to burn out"?
I wish there was a secret handshake, but honestly, self-awareness and reflection are key. For me, it was when I started dreading going to work, or found myself snapping at my husband over something trivial after a particularly tough day. Or, when my coffee consumption went from healthy habit to life support.
I feel seen. My coffee maker's basically my therapist.
So, once you recognize it, what then? The source talks about implementing support and interventions. What does that look like in practice?
It can be anything from mandatory debriefing sessions after difficult cases, to encouraging proper time off, or even just having a designated venting buddy. Sometimes it's as simple as someone saying, "Hey, you look tired. Maybe take a longer lunch today."
My intervention is usually ordering pizza and watching bad reality TV. Highly recommend.
I'm sure that's very therapeutic, Malik. Katie, what's the most unexpected way you've seen someone cope, or even yourself, when you were really feeling the weight of it all?
Oh, I have a good one. There was a period where I was just so emotionally drained, I started taking up competitive bird watching, like full-on binoculars, field guides, waking up at dawn. My husband thought I'd lost my mind, but there was something so incredibly grounding about focusing on something completely outside of human suffering. It was my weird little escape.
From end-of-life care to identifying a rare warbler. That's quite the pivot, Katie. I respect the commitment.
That's amazing, Katie. Who knew bird watching could be a prescription for burnout? It really highlights how personal self-care can be. But beyond individual coping, what about the organizational responsibility? How can hospice providers better support their teams?
It's crucial for leadership to foster a culture where it's okay to not be okay. Providing access to mental health resources, ensuring adequate staffing so no one is constantly overwhelmed, and really valuing the emotional labor involved in this work. It's not just about physical tasks.
So, basically, treat your employees like humans, not just cogs in the compassion machine. Revolutionary.
Malik, you always cut right to the chase. Katie, it sounds like this isn't just a tough-it-out kind of job. It requires a proactive approach to well-being, both personally and professionally.
Absolutely. You can't pour from an empty cup, especially when you're dealing with such profound moments in people's lives. Taking care of ourselves isn't selfish. It's essential for providing the best care possible.
So, more bird watching, less blank stares at the wall. Got it.
More bird watching, indeed. Katie, thank you for sharing such honest and insightful perspectives on compassion fatigue and burnout. It's a vital conversation, and your experiences really bring it to life.
My pleasure, Miles. It's a topic I feel very strongly about because it impacts everyone in this field. We have to look out for each other.
And that's a perfect note to pause on. We'll be right back after this short break. Welcome back to Heart of Hospice. Before the break, Katie, you were talking about bird watching as a coping mechanism. I'm still picturing you with binoculars, very serious. But let's pivot a bit, because the world of hospice itself has really evolved, hasn't it?
Oh, absolutely. From bird watching to bureaucracy. That's my life. But seriously, it's changed so much, even in my time in the field.
So, from comfort care to complex care with a side of spreadsheets and ornithology.
Exactly. The Medicare hospice benefit has been around for over 40 years. That's a long time. How has the role of a hospice medical director or physician really transformed in that period?
It's night and day, Miles. When I first started, it felt much more singular. Now, with hospice and palliative medicine being recognized as its own subspecialty, the fifth largest, mind you, since 2006, it's attracted so many dedicated physicians. It's not just a side gig anymore. It's a full-fledged career path.
Fifth largest? So bigger than, what, competitive bird watching medicine?
Ha! But seriously, Katie, you mentioned it's a career path. What does that mean for the day-to-day? Because the source material talks about roles expanding beyond just medical care to administrative responsibilities, leadership skills.
Oh, the administrative side? I remember one time I spent an entire afternoon trying to decipher a new regulatory guideline about documentation for face-to-face encounters. I felt less like a doctor and more like a legal intern. You're not just overseeing patient care, you're managing teams, ensuring compliance, even doing financial stewardship.
So basically, you need an MBA and a medical degree to be a hospice doctor now.
It sounds like it. And with palliative care advancing and perceptions of end-of-life care changing, the complexity must be through the roof. How do you navigate that increased complexity?
It means you're constantly learning. We're dealing with more complex medical cases, but also more complex family dynamics, ethical dilemmas that weren't even on the radar 20 years ago. It's about having a systematic approach, using ethical principles, but also a lot of empathy and flexibility.
Sounds like a daily episode of House, but with more feelings.
And it's not just within the walls of the hospice, right? The source talks about community and educational involvement. You're out there educating other healthcare providers, collaborating with medical leaders. Is that a big part of the job now?
It's huge. There's still so much misunderstanding about what hospice truly is. I've given talks to groups of primary care physicians who were genuinely surprised by the scope of services we offer. It's about building bridges, ensuring patients get referred at the right time, and dispelling myths. Sometimes I feel like a hospice evangelist.
So you're a doctor, a lawyer, a CEO, and a public relations expert, all for one salary.
Katie, honestly, how do you keep all those plates spinning? It sounds like a marathon, not a sprint.
It definitely is. You have to be incredibly dedicated and honestly, a little bit crazy. But the impact you have on families, on patients, it makes every single one of those hats worth wearing.
I'm just glad my job only requires me to wear one hat, the sarcastic commentator hat.
And you wear it well, Malik. Katie, it's truly incredible to hear how much the role has expanded and deepened. It's far more than just medical care. It's a holistic approach to end of life, requiring so many different skill sets.
It really is. And it's why ongoing professional development and staying connected with the community are so vital. You can't just rest on your laurels in this field.
So, continuous learning, community engagement, and apparently a strong understanding of regulatory jargon. It's a demanding but clearly rewarding path.
Absolutely. Every day brings a new challenge, but also a new opportunity to make a profound difference.
I'm just picturing Katie giving a TED Talk on the art of prognostication and the joy of compliance forms.
I'd watch that, Malik. Katie, thank you for walking us through the incredible evolution of hospice professionals. It's clear it's a role that requires immense dedication and a truly diverse skill set.
My pleasure, Miles. It's a field I'm passionate about, and it's important to highlight the depth of work involved.
That depth of work, Katie, it really makes me think about how much hospice care itself has changed. It's not just about comfort anymore, is it? We're talking about advanced palliative interventions now.
You're absolutely right, Miles. The landscape has shifted dramatically. We're seeing patients in hospice who are still receiving treatments that, even a decade ago, would have been unthinkable in this setting.
So less quiet contemplation and more dialysis with a view?
Malik, you always have a way with words. But seriously, Katie, the source mentions things like patient-controlled analgesia, non-invasive ventilation, even radiation therapy or transfusions. How do you manage that? It sounds like a whole different ballgame.
It really is. I remember a patient who was receiving non-invasive ventilation at home. It was incredibly complex to manage, requiring specialized equipment and constant monitoring. The goal wasn't to cure, but to alleviate severe shortness of breath, to give them a few more weeks of comfortable, conscious time with their family.
So you're basically running a mini ICU in someone's living room. No pressure.
That's a huge responsibility. And these aren't always required under the Medicare hospice benefit, right? So how do you decide when to support these advanced treatments? Is it a financial tightrope walk too?
It absolutely can be. It comes down to a very careful assessment of the patient's goals, their prognosis, and what truly enhances their quality of life without prolonging suffering. We have to weigh the benefits against the burdens. And yes, sometimes the financial implications for the hospice.
The classic do good, but also don't go broke dilemma. My favorite.
And the source talks about needing advanced prognostication skills. That sounds like you need a crystal ball, Katie. How do you even begin to accurately predict outcomes when you're dealing with such complex, advanced conditions?
If only I had a crystal ball, Miles. It's less about predicting the exact day and more about understanding disease trajectories, recognizing subtle changes, and having a deep, deep knowledge of how these advanced interventions might impact the patient's overall journey. It's an art and a science, honestly.
So you're basically a medical Sherlock Holmes, but with less Deerstalker and more empathy.
I like that, Malik. But what about the practical challenges? Is it hard to find staff trained for these advanced interventions? Or is it more about the logistics of getting the equipment to a patient's home?
Both, actually. Training staff is paramount because these aren't standard hospice skills. And then there's the logistical dance of coordinating equipment, ensuring it's maintained, and that families are comfortable using it. It's a constant puzzle, especially in rural areas.
Sounds like a reality show. Hospice Logistics, the rural edition.
I'd watch that. But let's talk about the ethical side again. When you're offering something like radiation therapy or transfusions, even if it's palliative, does it ever blur the line between hospice and curative care for families?
Oh, absolutely. That's a huge challenge. Families often see any treatment as a sign of hope for recovery, even when we're clear it's for comfort. We had a patient receiving transfusions for severe anemia, and the family started asking about chemotherapy again. It required very delicate, repeated conversations about the goals of care.
So you're not just a doctor, you're also a master of managing expectations. Good luck with that.
And how does the interdisciplinary team handle these discussions? It must be a collective effort to keep everyone aligned.
It's entirely a team effort. The social worker, the chaplain, the nurses, the physicians, we all bring our perspectives. We debrief constantly, ensuring we're all delivering a consistent message and supporting each other through those tough conversations.
So, a highly functional, emotionally intelligent super team. My kind of people.
It sounds like it. Katie, it's clear that while these advanced interventions offer incredible comfort, they also introduce a whole new layer of complexity, ethical considerations, and logistical hurdles for hospice professionals.
They do, but when done thoughtfully and with clear communication, they can truly enhance a patient's final months, allowing them to live more fully, even with advanced illness.
That's a powerful point. It's about expanding the definition of comfort, isn't it?
Precisely. It's about meeting patients where they are, with the best possible care, whatever that looks like for them.
So basically, hospice is now like a five-star hotel, but with more medical equipment and less minibar. Got it.
Malik. But I think Katie's point about meeting patients where they are is really the heart of it. It's a testament to the dedication of hospice professionals navigating these incredibly complex waters.
It truly is. Every day is a new lesson in adaptability and compassion.
Katie, this has been such an illuminating conversation. Thank you for sharing your incredible insights and for being, as Malik put it, a medical Sherlock Holmes in the world of hospice.
My pleasure, Miles. It's truly a privilege to talk about this work, and I hope it helps people understand the heart and complexity behind every decision. And yes, the deerstalker is in the